Welcome everybody to the very first podcast for Dairy from Norwegian Red. This is Kate Stai here, coming live to you from Hamar in Norway, and I'm here together with my colleague, Dr. Trygve Solberg.
Thank you very much, Kate. I'm so happy to introduce our first podcast talking about Norwegian Red and our sustainable breeding program. I'm looking forward to that.
What can people expect from us? What are we going to talk about?
Oh, a lot, Kate. I think they will have so many topics within animal health, animal breeding, sustainability, milk production, etc. So it's so many topics to looking forward to.
Fantastic. So our theme today is a really important one. We're going to talk about animal health. And we're joined by a special guest today, Olav Østerås, who is a special advisor within dairy health and welfare at TINE, the Norwegian processing company, and has a long, illustrious career within this area, both with the Norwegian Veterinarian Institution, also at the Norwegian Cattle Health Service, and as a professor at the Norwegian School of Veterinary Science over many, many years. Welcome, Olav.
Thank you.
Let's start off by setting the scene. Many of our listeners have never been to Norway and know very little about Norwegian agriculture. Can you tell us, what does a typical dairy farm in Norway look like, and how does the industry work?
Thank you very much, Kate. Norwegian agriculture is very varied because Norway is a long country from south to far above the polar circle. I would say that generally, the farmers have a lot of influence on the decisions within farming because most of the organizations are organized as a cooperative. I would say half of the dairy industry is milked from a milking robot. Typical 30, 40, 50, up to 60 milking cows. That's the typical average. And the grazing season is from May to September. So it's a big variation, yeah.
I think it's very important to stress that many of the dairy farmers belongs to the cooperative. Like Geno is a cooperative, TINE is a cooperative, which means that farmers are doing things together, trusting each other and sharing information, etc., etc. And to health, I think it's very important. It couldn't be done what we have done in Norway without cooperatives.
Yeah, I think that's a good point, Olav. The structure and the influence the farmers have is really important.
And I think it's very important to recognize that farm size is international quite small. It's a family farm unit, and the politics is like you should do dairy farming up in mountains in the valley to grow grain in area where you can grow grain because the country is so far north. And yeah, it's mixed with some politics and family farming.
That's interesting. We've heard that Nordic cattle really lead the way for cattle health internationally. Is that true? And if it is, why is that the case?
Yeah, one should be very careful to say best in world in everything because it's always somebody who is better in something than you are. But in general, Norwegian health is pretty good. We have eradicated lots of infectious diseases. We seems not to have paratuberculosis. We haven't seen any positive cases of Mycoplasma bovis so far. Mastitis situation is quite good, and we have improved this very much the last 20 years. Like the treatment rate of mastitis is decreased by 70%. Ketosis is decreased by 90%. Reproduction diseases is lower, etc., etc. And we have also a very good control of antibiotic resistance. So what we know about samples going to the mastitis lab on Staph aureus, it's only 2 to 3% which is not sensitive to penicillin. So penicillin is really the drug of choice when we are treating animals.
But Olav, you mentioned, of course, here that the health situation is extremely good here in Norway, and that is maybe something unique. And I know that we record basically everything or all treatments of cows. We have introduced something that we call the health card. Can you tell us a little bit more about the health card and this recording system and how we have recorded treatments of each individual cow?
Yeah, it's quite interesting. And to those who are not common with the health card, it's a little complicated. So I would try to tell a little about the history of the health card to see how it started. It started, in fact, in 1967, 69, with a trial project. And the key thing was that Geno wanted to have a knowledge about mothers for elite bulls, which, if they have cystic ovaries or non-estrus. And for veterinarians, it was very difficult to state that in a statement to Geno, so they needed some notification on these cows. So then they started a trial with the health card, and in fact this was made as a national system after 1975. So it covers the whole country. First, it's very interesting because code number 0 was anestrus, code number 1 was cystic ovaries, so it tells us about the importance of reproduction diseases in the start. But after some years, it covers all different kind of diseases. We have a fairly simple system with 50 different codes. And I think in production animals, there is not need for more codes. It is needed to be rather rough. And this was based on an appointment between the Veterinary Association and Geno in first years. And after some years, also animal recordings were introduced. So these recordings on the health card was gathered with the TINE advisors. So it was reported into the animal recording system. And the fortune is that we have all information in one database. After some years also, this was part of the official recording system. There was some opposition, of course, first, both from farmers and veterinarians and also the official authorities. But after some years, it was made as an official recording system. But in the 80s, it was turned again over to the private sector to have the responsibility. So it is really the animal recording, Geno, and TINE, which has the main responsibility for running this system. And from 2012, we were modernized, so the veterinarians are obliged to make journals, obliged to make reports on all medical usage into the food authorities. And there was made a system so they report everything automatically also the diagnosis in digital format into the animal recording system. And we have also had a scientific project to evaluate the validity of this reporting system, and it turns out to be very good. So it covers about at least 90% of what's happening out there.
So would it be right to say then that every single animal that is born into the Norwegian population, it has its own individual health card, and then every treatment that happens through its life, the veterinarians they're required to report it. It's part of their daily role.
Yeah, that's right. Every cow had her own yellow card, which she got when she calved for first time. We also made a young stock health card for reporting calf diseases. And calf disease is quite difficult to get reported, but we succeeded after some years with feedback to farmers. And I think we now have reports on dehorning, on respiratory disease in calf, diarrhea, etc. So Geno has made some trials where they found genetic correlation with respiratory diseases. So it's a heritability there as well.
And that's important that you mentioned that, Olav, because when you speak about heritability, that means that it is possible to improve the genetics part. And health has been included in the breeding goal for Norwegian Red for many years. And the reason why we could include it is actually the fact that we have all these records. So that's the fundament for including health within the breeding goal. Right. And we have proven that it's possible to improve health genetically in the Norwegian Red. So it's several reasons why we have such a good health in Norwegian Red. That's also a genetic part, of course, but also the utilization of the health data that we have in the herd recording system.
It's quite interesting because as milk production increased in Norway in the 50s and 60s and 70s, we saw an increase in mastitis treatment and production diseases. And farmers and veterinarians were arguing that the breeding was going in the wrong direction. So there was a huge discussion between breeders and farmers and veterinarians about health and production. And the breeders then said that, well, if we should test this, we need some records on health. So that was one of the main reasons why they made all these records. And it was included in weights from mastitis to post milk production from 75 or?
Yeah, at least in the beginning of 1970s, because when this health record had started in the 60s, it took some time to accumulate the necessary amount of data, of course. So I believe it was included in the breeding goal in the beginning of 1970s.
I think that the main results of this breeding was seen from 93, 94 due to the generation. And if we estimate the reason why we have 70% reduction in mastitis treatment, I think that breeding have one third of the reason.
One of the indicators when we think about health is, of course, related to antibiotics. It's one of the key things that we can measure. And when I was reading up about it, the EU releases a report each year through the European Medicine Agency, which shows the level of veterinary antibiotics which is sold for food-producing animals, including cattle. And year after year, Norway reports the lowest sales of antibiotics How has Norway achieved this, and is it possible for other countries who have a medium or high level to come to the same level as Norway?
Well, I think we should be very careful to compare different countries because it's different systems, different agriculture, different attitudes. But I think it's very, very possible to decrease the use of antibiotics. We saw a huge increase in use of antibiotics from 75 to 94, and it turns out that farmers were really hiding good quality, low somatic cell count. So cell count was paid in a quality system from 85. I think that many farmers were overdoing this, so we have to change the attitude, and that was really done after 94. And one of the reasons was there was a huge use of antibiotics in salmon industry. And they reduced from 32 tons to less than 1 tons in 2 years. And then the politicians started to talk about agriculture, what was going on in agriculture, and it was a need to change the attitude to use of antibiotics. I think it was partly a political reason, lots of attention in the media, and I think also here cooperatives are very important because farmers could just go out and say, we wanted to change this.
Yeah.
And that's done by breeding, by preventive medicine, and changing of attitudes.
Trygve, I have a question maybe more for you. Internationally, we see a growing trend towards crossbreeding. Why do you think Norwegian Red is a good choice for crossbreeding, particularly for those Holstein or Hojo herds, which currently take up a large majority of the dairy industry?
Yeah, we have now heard that one obvious reason is, of course, extremely good health. That's one reason. The other reason is is very good fertility. The Norwegian Red is famous for superior fertility. And I also say that it's sizable. It's a medium-sized cow, very feed efficient. And the Norwegian Red, we have included a very broad breeding goal for many, many years, which has created the Norwegian Red to be very robust. And that means that the Norwegian Red will recover very quickly after giving birth, for instance. So the metabolic, the energy comes quickly up to speed for the Norwegian Red compared to other breeds. So main reasons is good health, of course, superior fertility, and a feed efficient cow.
And as you said before, Olav, the genetics part of it, of course, is just one part when it comes to health. There's a lot to do with management and regulations and the environment that the animals are in. So, Trygve, based on the genetic side, have you seen anything in real-life results on farm, particularly for our US customers, where they've used Norwegian Red and crossbreeding? Does it have any effect for health traits?
It has an effect, definitely. We have several farms in the US that have used Norwegian Red in a crossbreeding program, and there we have had the opportunity to compare pure Holsteins versus the crossbred animals. And what we see is that typical somatic cell count is significantly reduced on the crossbreds compared to the purebred Holsteins. So we have seen a quite a dramatic positive effect on the crossbreds compared to the purebreds, yes.
And Olav, one thing you touched on earlier, which I think is really important, is also that around calf health and survivability, because when we talk about cattle health, there's a lot of focus on those transition diseases, udder health, mastitis, kurtosis. But now that we see, particularly internationally, more and more use of sick semen, so a lot more heifer calves coming out where farmers are investing in the technology and the genetics, and they really need those calves to make it into production. What has Norwegian Red done to really promote calf health? Or Geno?
Yeah, I think that when you're breeding for resistance on mastitis, probably you are improving the immune system. And that would, it wouldn't surprise me that that will also have an impact on calf disease. Like we see, there is a heritability on respiratory disease. So I think it's very important. And I would like to add concerning mastitis, I've been in practice as a veterinarian, was a student in middle of 70s, and there was not very seldom we saw really heavy cases of mastitis, even with gangrena. And we never see that anymore. It seems to me that the symptoms are changed very much more and more over to mild cases. And the cell count in Norway is still, we have very little use of antibiotics. The cell count are very, very low. I think we can prove that we are among the best in the world. Competing with the Finns, it's only one country which has lower cell count, and that is Switzerland.
It's interesting.
Okay, let's be honest there. And the disease outbreaks can happen, of course. And we have customers internationally who deal with diseases like tuberculosis, for instance. And we hear about very little of these kinds of instances in Norway. And from a veterinarian's point of view, Olav, what is the secret to protect yourself from diseases or avoid outbreaks, regardless of which country you're in?
Yeah, that's a very difficult question. I see that the fortune we have in Norway is that we are so far north, and we have had very strong regulation. So we have bovine leukosis was eradicated very early. Brucellosis was eradicated in 1953. Last case with tuberculosis was in 1963. But to keep up this, I think it's very important to have a cow with a good immune system. Yeah, I think that's and we are very restrictive to trade of animals across countries. We have lots of trade of animals within a country, and we are working with that. But I do think that all these trade of animals throughout between different countries in Europe is not really sustainable.
But just a quick follow-up question here. That is somehow related to the use of antibiotics as well, because that's my impression that, I mean, all the veterinarians in Norway, if they treat an animal with antibiotics, it's mandatory to report it, right? And the veterinarian do not have any kind of financial benefit of selling antibiotics.
Yeah, that's
that's a difference between I would say Norway, the Nordic countries versus international, isn't it?
Yeah, that's a Nordic model that veterinarians are not allowed to take more money for antibiotics than they buy it for themselves. So they are earning their money on putting the right diagnosis, and I would like them to work even more on prevention. And reporting is, of course, very important. To have health record is a key thing in doing this. And this also leads to that I would say in mastitis we don't have any resistance problem, antibiotic resistance problem anymore.
Okay, that's it from us. I would like to thank you, Olav, for coming in and spending time with Trygve and I today. And I hope that our listeners have learned a little bit more about Norwegian dairy farming, the Norwegian Red breed, and the systems that we have in place to make dairy farming more sustainable and healthy. So from all of us at Geno and Norwegian Red, we wish you a happy and healthy herd. And you can get in contact with us at any time via our website, Norwegianred.com.